Welcome to Top Class with me, Duncan Crawford, where we're discussing how to tackle inequalities through early childhood education and care. It goes without saying that the first few years of a child's life are hugely significant. If a child falls behind in their learning and development early on, that can mean staying behind and never fully catching up. So how can countries ensure that all kids get lasting benefits from attending nurseries, creches, kindergartens and pre-primary education? To discuss this, I'm joined by two experts, Stephanie Jones, the Gerald S. Lesser Professor in Early Child Development at Harvard University, and Professor Henrik Zachrisson from the Centre for Research and Equality in Education at Oslo University. Thank you to both of you for joining me.
Happy to be here.
Thank you. Happy to be here.
Today we're talking about education and care for kids aged around 1 to 5 years old. And in many parts of the world, some kids in their early years still do not benefit from these services, particularly high quality services. Professor Stephanie Jones, if I could start with you, what's the situation in the States? How would you assess early childhood education and care there?
Well, I would describe it as a complicated system that serves about 50 to 70% of children ages 3 and 4. They're in some form of early education and care. But the way what that setting looks like can vary quite a bit. It might be a public school pre-kindergarten. It might be a center-based organization of some type. It might be a setting that we would describe as kind of more informal, like a family child care. It might be a Head Start program, which is designed to serve children whose families' incomes fall below a certain level. So it's what we describe as a mixed delivery system. The thing about it is that quality across that system varies a tremendous amount. So it's not necessarily the case that any particular model or type of setting is lower quality than another. It's that there's a lot of variation in any setting type in its quality. You can have high quality family childcare, high quality Head Start, or you can have low quality family childcare or low quality public pre-K. So the challenge of quality is a substantial one in the US and, as you said, around the world.
Okay. Professor Henrik Zachrisson from Oslo University, let me bring you in. What's the situation in Norway? Are there similar quality issues as described by Stephanie there about the States?
Norway is, to a great extent, the inverse of the US situation. In Norway, we have a public early education system where all children in Norway currently have the right to a slot in a publicly funded center from age 1, where parents pay a fee of a bit less than $200 or euros, and where structural quality features like teacher education, child-staff ratios, play areas, etc., are governed by law. So we have a national coverage of 1 and 2 year olds in Norway. A little bit more than 80% of them attend public childcare, and approximately 96% of 3 to 5 year olds. So it's a very different system. It is funded by the government through the municipalities, so the lowest kind of regional governmental level, who both own approximately half of the centers in Norway. The other half is owned by private profit or non-profit organizations, but they are regulated and funded through the same system.
Stephanie, when parents in the States and maybe staff at early child education centres hear about what it's like in Norway, are they drooling at the prospect of having a system like that, or are there disadvantages to it as well?
I was just, of course, listening to that description and drooling a little bit myself and reflecting on how the mechanisms for funding early education and care in the U.S. are highly distributed. There's like a small amount of funding that goes from the federal government out to the states. And beyond that, it's mostly individual states who are funding this kind of array of services. Head Start is funded directly from the federal government to local organizations, and that's really the exception. So it's quite different the way any particular system looks from state to state. So how many slots in settings are subsidized, what the distribution of formal and informal offerings is, how much public pre-K there is relative to, locally owned or private offerings. It's really quite different. And, we don't yet serve nearly as many infants and toddlers, and it's much more expensive. So I would say that there would be a fair amount of drooling among the group of people who really care about this issue and those who have young children. There are some commonalities, I think, which is that, questions of universal access. So like who really has access to the highest quality settings, who is, systematically left out, and how do we increase access in the ways that we want to while simultaneously improving quality. That seems like that's a universal issue.
Yeah, Henrik, my understanding is that in Norway, like you say, basically universal participation in early care programs for families, but that's sometimes for people who have higher social economic status. Some less advantaged children do not participate still. There's still some issues on participation. Is that a fair assessment or not?
It is. The system is not designed to leave kids out, but there is, particularly among the youngest ones, the 1 and 2 year olds, a lower participation rate among those from families where parents have the fewest years of education and who have the least money. The specific reasons for that are unknown. We speculate that there are, in part, financial incentives that may be at play. In Norway, parents are currently paid a not unsubstantial amount of money to stay home with their kids for the second year of the kid's life, which might disincentivize some. There is also an application process which might be offsetting for some parents. And I think there are also kind of subcultural values in when to let the government take care of your child, which varies. I was part of a government-appointed expert group giving advice on alleviating child poverty and consequences thereof in Norway. We submitted a report last year where one of our primary suggestions were to essentially allocate a slot in early education from age 1 to all children. You don't need to apply, and to remove the parental fee from half of the day so that you remove any financial incentive there might be left. And in addition, remove this Cash for Care program, which we find to probably be part of the reason why we have this inequality, which is both among children from lower socioeconomic status and also among children born into families with origins outside of Europe.
The Starting Strong 8 report, which is this new report on early childhood education and care, it highlighted that two of the main problems that need to be tackled in this area are firstly that vulnerable children participate less, and that secondly, even when they do participate, it's often in lower quality programs and settings. Stephanie Jones, why are disadvantaged kids less likely to go to nurseries or creches in the States? We heard from Henrik about why it's the case in Norway.
The obvious answer is that they just simply don't have the resources to pay for it. But I don't think it's as simple as that. That is certainly partly true. I think one of the funny things about the U.S. is that there are programs that are designed to support, enable low-income families to access early education and care. So Head Start is one of the examples of that, which is a national program. It's been around for since the 1960s. And that serves families who have low incomes. It doesn't serve everybody who wants it. So it's still not fully serving everybody who needs a slot. But states do offer subsidies to low-income families to go to programs in those states. The funny thing about this is that what we see in our data, we have a big longitudinal study in Massachusetts that's really designed to look at the system quite closely and the children in it and then follow them for a long period of time. And what we see is that the group who really is struggling to access early education and care of some sort is not the lowest income group. It's the group just above that. And you know, it's a group that like verges on what some call middle class, although I think we'd all debate what that really is today in the US. And that's a group that doesn't have a low enough income to qualify for a slot, but they don't have enough money to pay for the cost of early education and care as it stands today. And that's the group that feels in the U.S. Really underserved, and they are really struggling to find something. There are often two parents in those households who are working. So that's the conundrum there. It's like a system that isn't quite meeting the needs of the entire spectrum, right? Those who can pay. Those who really can't pay have general access to something with a subsidy or to Head Start, but it's those in the middle who have to pay but don't have enough money to pay who are underserved.
Okay. Well, that's the situation on participation. What about how to ensure quality for early education service providers? How hard is it to provide quality education and care services when in many countries, the people who are working there, they're complaining that they're underpaid, they're overworked, and that they're underappreciated? Henrik, what do you think about that?
I am afraid many working in early education centers in Norway will subscribe to that description as well. Early education teachers in Norway have a equivalent to a bachelor's degree, and they are paid substantively less than a teacher with equivalent education in primary school. And that has been an issue in this country as well as in all other countries for a long time. The things that we can regulate in early education centers are, it's the qualifications of the staff, it's the availability of learning materials, it's the spacing, it's child-staff ratios. And in Norway, those things are strictly regulated. And among the toddlers, the 1 and 2 year olds, there is a 1-to-3 ratio, 1 adult per 3 kids, 1-to-6 for 3 to 6 year olds. And that's probably, it's the expensive place to start, but probably also the place to start at the structural level to ensure quality is my guess. Stephanie?
The system is like 50 different systems, right? 50 systems in 50 states. And that is true for some of these structural features as well. So the child-adult ratios, the kinds of expected curricula, if we could even say that, levels of educator education and experience, like all of that stuff, those structural characteristics do vary across the states. There's been movements to have standards related to experience and credentialing, that every early educator has a bachelor's degree. Those have gone far in some places and not in others. I think that one of the key issues related to those structural features that we will probably all agree on, which is that those structural features are really important. They are the levers that policymakers typically have to pull. But if they do not translate into high quality, direct interactions and relationships between children and the adults in the setting, then that structural lever isn't super effective. So it's not simply the fact of a bachelor's degree that could make for high quality in an early childhood setting. It has to turn into, like, whatever that bachelor's degree is, has to drive into high quality interactions and relationships. Like, that's the secret sauce. That's the proximal influence on children's outcomes and experiences. That's the thing that carries that experience into the future. So the real conversation is, what are the kinds of structural features that policymakers have control over in the places where they are making policy? And number two, how can we make close links between those structural features, those policy levers, and the direct experiences of children in those settings? And that's been something that is really hard to tackle. It's hard to define. It's hard to make the links in research. Those two areas, the structural features and those kind of dynamic proximal process features, those interactions and relationships, and the connection between them, that's the place to work, I think.
I want to get your views on one of the points made by the Starting Strong report, which is that early childhood education and care, when it's well funded, that it's a cost-effective way of boosting educational outcomes, that these benefits can be reaped over a longer time, and that by putting funding in early on, it can help elevate education from the start, which means there's less problems longer term. Do you both think that long-term inequalities in education and with that inequalities in societies could be tackled if there was greater emphasis on early education and care?
I'm convinced that there is not one single silver bullet for making sure that kids who grow up in poverty or otherwise are vulnerable live a productive and happy life. It's a function of many things. I just did a study with 3 American colleagues where we used a longitudinal data set which covers, it's more than 1,000 kids who were followed from 6 months of age and currently through age 26. In that study, we tried to paint a picture of the educational opportunities, the educational life opportunities that kids encounter across their lives through early, middle, and childhood and adolescence. In home, in childcare, where we have observational quality measures, in school, after-school activities, in their neighborhoods. What we were able to demonstrate in that study was that the opportunity gaps that we talk about, they are empirically real. The way we define these opportunities, the kids born into poor families, they had very, very few, if any, of these great educational opportunities throughout their entire lives. The kids in high-income families who were not really rich, but kind of upper middle class, upper middle class in the US, they had abundance. And especially for the kids born into poor families or low-income families, the presence of a few of these opportunities throughout their lives were associated with substantially higher rates of college graduation and much higher income at age 26. Sustained high-quality care was one of the criteria here. Whether that can be substituted by something else, yes, it seems like it can. So it's something about, I do not question the importance of early education, but life is so much more than those hours spent there. And kids who grow up in poor families or otherwise in challenging environments over time, they have so many different things that impact them and shape their lives. And while that's a super important part of it, I don't think we can solve all problems in the world by early education. Sorry to say.
So Stephanie Jones, I mean, Henrik there is basically saying that if children are lagging behind early on, that there are other opportunities for them to catch up. But the argument put forward by this Starting Strong report is that if you do put in extra funding, for example, to boost quality in the early years and to make sure that disadvantaged kids get the same opportunities as others, that means they don't fall behind in the first place. So do you believe there should be greater emphasis on improving access to early care services and improving their quality as well?
Absolutely. I completely stand behind that idea, that need. It is profoundly important. And it's important for all the reasons that we just heard. And it's important because it offers that boost. It can sort of level the playing field at the start of schooling. It can offer a set of supports and experiences that promote resilience to some of the things that might happen later, especially for low-income, vulnerable children. There's so many benefits from that early childhood period for the early childhood period. And we think that will carry into the later years. I think that the challenge sometimes with the rhetoric around early childhood is that we talk about those experiences as being completely deterministic of the future. And what Henrik is saying is that is not the case. The data don't bear that out. And that is true from all the studies of high quality, whatever kind of quality early childhood experiences, is that they tend to, on average, make a difference at the end of that moment, that early childhood moment. And then sometimes we see effects carried into the future. Sometimes we don't. Sometimes we see those benefits fade out over time. And I think the message is that it's profoundly important as a global public good, right, for families who need to work. It's profoundly important as a leveling opportunity and a boost for children who are struggling and, for children who aren't, but whose parents are working. Like, it's something that we absolutely need to have. It has huge benefits.
You've described it as a global good there and all the reasons why it's important. And I want to talk about funding because some families can't afford to put their kids in nurseries or creches. And at the same time, lots of countries are facing tight budget constraints. So you don't have to talk about this in the context of the US or Norway. You can talk about it more generally. But how do countries change this situation if the money's not there to fund the places and the staff and the heating for the building and so on? How can you improve the quality of care and how can you improve those participation rates without more money?
That's the billion-dollar question. And, I don't have a good answer to that, obviously. I think if we knew exactly what to do and we had public and political will, we would do it. I mean, maybe that's the issue. There isn't even public and political will to take action in ways that we think might be effective. I do just want to say that it's important to remember that high-quality relationships and interactions can happen in any context. It's not the case that you need some sophisticated, specialized curriculum or training for an adult to generate high-quality interactions and relationships between adults and children. Those things are more likely to happen if they are fostered and supported inside of a system where people are well paid and well supported and there are dedicated, consistent funding sources and so on. But it's not the case that it can't happen. So we have to think about how to build a system that has the hallmarks that we all talk about: educator pay, benefits, high quality professional learning and support, dedicated funding sources, ways to expand without reducing quality, all of those things, while remembering that many folks are doing this work already and doing it really well. So there's a top-down, bottom-up kind of approach to this work, which is what are we seeing that's really working? And how can we lift that up and sustain it? And then what are the levers we can pull inside of a system that enable that to happen more systematically and in a way that is better supported?
First, want to say that I absolutely agree with everything you said, Stephanie, to the last point. And with the same data set and the same colleagues, I have also shown that sustained high-quality interactions over time during the toddler and preschool years have very positive effects for low-income children's both later salary and graduation rates. So it's not to say that early education is not important. I was just sharing Stephanie's perspective that it might be optimistic to say that that's the only thing we need to do. Having said that, with early education, there is a big picture which was driving what happened in Norway back in the 70s when there was a big preschool expansion, and also the intention behind the expansion of public toddler care in 2000s, which is women's workforce participation. And it's very important from a funding perspective in all respects to maintain the long-term perspective on both whether quality care generates returns in productivity for the children who attend care, but also the long-term productivity of their parents. If you can make a greater proportion of primarily women, unfortunately, in the world who are the ones staying home with their kids, have a shorter gap in their work careers, you will, as far as I know, maintain their links with the labor force over a longer time, and they will be more productive over time. So that's part of it, that you kind of release a great number of productive members of society.
What I'm about to ask isn't relevant to the US, but some countries, for example, education is free at the ages of 17 and 18. Some countries, education is free to go to university. And that is funded by the government, but education for kids at the age of 1 and 2 and 3, the money isn't there. And I guess the argument would be, why does a 19 or a 20-year-old who's already had that much education get money spent on them, whereas the 1 or 2-year-old doesn't, when, if we're saying the research shows that has such long-term benefits and reduces inequalities, why wouldn't that be the right decision to make? Your thoughts on that?
Well, I have thoughts on that because that's the situation in Norway. And many of us working in the early ed research field here have pointed out the irony that if you are smart enough to enter the university, the education of which on average will put you on a much more favorable income earnings track over the life course, it's actually free here. That irony is real. Having said that, I think the bigger picture with early education as we see it in Norway, and I think this generalizes, if early education is considered as a public good, equivalent to what we have, universal healthcare, elderly care, public schooling, it's really hard to get the genie back in the bottle, right? Because it's so important and it's so popular to have those policies out there. And that is probably, is my personal guess, the reason why you don't touch tuition for universities in Norway, because it's been like that since before I was born. And you can't remove it because it's so popular. And that's why I think one of the leverages here is if you're able to provide something which gains that traction, where people essentially would vote out anyone who is willing to or proposes to withdraw that type of privileges, which a public early education system is, they will be voted out. Almost everyone in society benefits in some way or another. Grandparents who see their grandchildren thrive in early education, parents who are able to go to work. Everyone have some linkage to the early education system, directly or indirectly, and as a public good. In my country, it's considered just as important as all the other things I just mentioned.
I want to talk about coordinating with other services, because inequalities in childhood are not solely down to education services. And there are various ways to regulate the costs of early childhood education and care. You could have cash benefits, tax breaks, subsidies, and so on. But could money be spent more effectively if government departments work together? Social affairs, family departments, education departments, and so on, they work closer together. Henrik?
I certainly think so. And this includes child welfare services, health services, yes. The early educators are in a unique position to observe in a public system all children. Over time, they meet the parents. They know probably more than anyone what's happening in the family and the struggles and resources that might be there. At the same time, they have a pretty busy job. And I think one thing which I endorsed in the report, one of them was the idea of interagency corporations. And I think the important thing is to think very kind of specifically and structurally about barriers for cooperation. So the easier it is to address the lowest level of support outside of a center, being school psychology services, being well baby clinics, where the access and response time is low and where it feels helpful for the childcare staff to make the contacts. So it kind of reinforces the use of a hypothetical system without barriers. I believe is tremendously important because, and this is especially true for families kind of living on the edge of the labor market with very few financial resources. It is a very chaotic life. That's true in Norway and that's true everywhere. And the idea of using the space where professionals meet the families and the children as an entry point into providing meaningful support of social workers, of healthcare workers, of school psychologists, etc., is, I think, in all systems I am aware of, an underused resource to support families.
Stephanie Jones, what do you think should happen to improve cooperation between departments to reduce inequality?
They should coordinate. I don't think I have an answer for exactly how, but there is some evidence that coordination reduces costs, and there you recoup resources that can be reinvested in the system. Going back to the prior conversation, I mean, there was a moment I think it was during Obama's administration, where assistant secretaries in Health and Human Services and the Department of Education intentionally crossed the bridge and came together and did some coordinated work around early childhood. And it was so innovative and unusual. And folks got really excited about this coordination, partly because early childhood, as Henrik was saying, is at its core an opportunity for primary prevention, right? Because those early educators are seeing many aspects of child development in those early years, and they're often very, very closely connected to parents. And that just represents an opportunity to offset or to intervene when things arise that can offer huge benefits and cost savings in the future. So coordination and pushing in an integration of services inside a platform, which could be early education, is a really smart way to think about cost savings and benefits for children and families and the future.
What else can be done to improve the quality of early childhood education and care in terms of what's taught? What sort of skills or competencies would you like to see being taught early on? Social emotional skills, for example.
I mean, I am, as you know, in my other life, very focused on social and emotional skills, and behavior is like the foundation for many things, if not all the things. So no surprise that I would say that those are really important foundational skills that are built in early education contexts. I think less about like specific skills that are taught and more about how to design experiences that enable skills to grow and change rather than like in early childhood teaching specific things. It's really about how do we set up conditions and settings so that children have experiences where they're learning all these things. And early childhood, I think in Norway, maybe less so, increasingly less so in the US, has an openness and a flexibility that enables us to think more kind of experientially and at the setting level about sort of what children are exposed to and how they're navigating their own learning than we tend to have in the later years. And that's a real opportunity, I think. Children learn all kinds of things that way. Letters, numbers, social, emotional, all of it.
How do you go about assessing the quality of an early education centre and then sharing those best practices with others, Henrik?
I think it's a really good question. And my take is that we don't really know. The reason I'm saying that, and I know that very, very wise people disagree with me on this, is that the ways that we have approached quality assessments, as Stephanie mentioned, they tend not to be very strong at predicting child outcomes. And I think following up on what Stephanie said, it's a peculiarity that in the Norwegian system, we have a very different philosophy underlying early education quality than many other countries in the world, where values like democracy, creativity, art is a very, very integrated part of it. And I've been thinking a lot about this because we find for children, vulnerable children, as you say, we find benefits on test scores at age 10 of entering into care before age 1.5. And what are they doing when they're a year or 2 years old in Norwegian childcare centers? They walk around in the woods, they play, they draw things, they hug trees, and it's a pedagogy which is directed at the types of experiences that Stephanie mentioned. And the educators are there, and they are doing a tremendous job, but they are not teaching the kids stuff. They are facilitating the kids' experiences without learning letters or learning numbers, but they are providing them with experiences that, for some reason, and I don't know why, eventually turn out in test scores of considerable proportion for those kids.
Totally. And I would say that just hearing that description, I would pull out a few things that could be measured that aren't typically in our quality measures measured so directly. So they would be things like how much are children talking, right? How much are children talking to each other? Certainly at home. But how much are they talking and how much are adults listening, right? Rather than adults talking and children listening. So that's one thing. The other is, what's the tone and the sort of vibe between adults and children? Is it warm and supportive and emotionally attuned, or is it something else? Are there routines that shape how children move through a setting? Can they predict day to day that we're always going to do this, and then we're going to do this, and then we might walk in the woods? That sort of the routine and the predictability and the consistency is a very positive thing for human development. Do they have opportunities to get completely engaged in whatever it is? It doesn't have to be the woods necessarily. It could be the trucks. It could be whatever it is that was going to capture their attention, and they have agency and autonomy in exploring it. So, and those are fundamentals to both child development. Like these are characteristics we find in the literature that we know predict positive outcomes for children. They're also things that we can see, right? We can observe them if we look for them in settings, even if it's in Norway and structured the way Norway is, or in the US, in the Head Start Center or family childcare. Like these are kernels. I love this word, kernels. I use it all the time for many things. They're like kernels of effective practice that is really well suited to positive development in early childhood. Those are the things we should look for. If we really systematically look for them, my guess is we'll begin to see greater connections between the things we think are really effective structures and the kinds of things that are effective processes and then child outcomes. I don't know. It's a theory.
Okay. Thank you so much. We are out of time, unfortunately. Thank you so much for taking part. Professor Stephanie Jones from Harvard University and Professor Henrik Zachrisson from Oslo University. I hope people have found this an interesting and informative listen. If you're interested in learning more about this topic, then please check out the new Starting Strong report. It's Starting Strong 8, Reducing Inequalities by Investing in Early Childhood Education and Care. Search for it on your search engine or on OECD.org. There's also the previous 7 Starting Strong reports you can read. So a lot of bedtime reading for you. That is all we've got time for, though. Thanks again to my guests. And if you like this podcast, please subscribe and please join us for another episode of Top Class soon. All the best.
Thank you.
Thank you.